Now, an 8 on Your Side investigation, sick and tired, cutting delays, providing non-VA health care to veterans. You paid for it, so what's gone wrong?
Well, according to figures obtained by 8 on Your Side, 1 in 4 veterans seeking non-VA health care wait more than 30 days to get a doctor appointment. Cutting
those waiting times is what the new Veterans Choice Program is all about. Senior investigative reporter Steve Andrews tells us why so many veterans are waiting so long.
Jen, taxpayers shelled out $10 billion for the Veterans Choice Program, and until today, Luis Salvato would tell you it wasn't worth 1 red cent. When Luis Salvato was a Marine in the late 60s, he had no idea he'd develop liver disease and need medical help from the VA. He also has no idea why he's had to wait more than 2 months to see a non-VA doctor for his illness.
It's very frustrating.
Luis is enrolled in the Veterans Choice Program. It allows him to seek medical treatment from the private sector instead of driving all the way to Tampa's James A. Haley VA Hospital. HealthNet is the contractor the VA pays to set up his appointments.
They are actually taking longer than if you just went right through the VA.
The National Office of the Veterans of Foreign Wars is closely monitoring VA health care. It found 26% of the veterans seeking treatment from the private sector wait 30 days or longer for appointments. According to the VFW's Carlos Fuentes, who I spoke to via telephone, part of the reason for the delay is that until very recently, the VA has used the private sector only as a safety valve.
The VA has traditionally wanted to be everything for every veteran, and what the healthcare access crisis has taught us is that that's not very possible. It's not very feasible for VA to provide every instance of care to every veteran.
Another problem with the Choice Program, the VA was not very forthcoming with providing data about how many people it would be sending HealthNet's way. Reached in California, HealthNet would not discuss Luis Salvato's case. Instead, spokesman Brad Kiefer issued a statement saying HealthNet was scheduling 34,000 medical appointments and fielding more than 230,000 phone calls monthly in support of the Veterans Choice Program. Now, Luis contacted me about an hour and 15 minutes ago. He got a call from HealthNet in Tampa this morning. They saw a report about him yesterday. He then received a call from HealthNet California. They set up an appointment to see the doctor he's waited to see for more than 2 months.
Boy, isn't that interesting? So that's where the question is, if you can make a phone call, ask a question, and things get done, why is it so difficult for these guys to get done when a veteran needs help?
Well, this is a program that was just implemented very quickly. It's changed its eligibility rules on the fly, and it's rapidly expanding. I mean, with it developing so quickly, you knew there were going to be problems out of the gate.
Okay, so wait and see how quickly they can fix these issues in the future. All right, Steve, thanks so much.
You bet.
Well, and if veterans don't receive timely access to care under this Veterans Choice Program, call the HealthNet number on the screen. We put it right there for you, 866-606-8198. And if you've been having trouble with the VA, our investigators want to hear about it. Call 8 on Your Side. That number is also now on your screen, 1-800-338-0808.